Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Ria Tanwat Cotrillo. Today on the program, President Bongbong Marcos sits down health department officials, but without a designated head as yet. As the government pushes for full face-to-face classes in November, how can schools ensure a safe transition amid the pandemic? And the Makabayan Bloc refiles a bill seeking to grant a new TV franchise for ABS-CBN. Health advocate Dr. Leachon and ACT Teachers Party List representative Franz Castro join us live. President Bongbong Marcos met with health officials Wednesday to tackle COVID-19 response. But 6 days into his office, it is still unclear who the chief executive will appoint to lead the key department. Malacanang says the meeting centered on bringing down transmission and improving vaccine coverage. Among those present was Health Undersecretary Maria Rosario Vergere. A day after reporting more infections of highly contagious subvariants, the health department points out most Omicron cases are only mild to moderate. Latest figures show only about 3% have become severe and critical. Total Omicron infections are at over 7,900 with 70 new cases on Tuesday. Let's go straight to the source of the story, health reform advocate Dr. Tony Leachon. Dr. Leachon, thank you for being here.
Good morning, Ria, and good morning, everyone.
Now, Doctor, it's exactly a week since President Bongbong Marcos took office, and there is still no health secretary. Tell us how crucial it is to have a health chief at this point.
Well, the appointment of a health secretary is extremely important because the Secretary of Health will provide the blueprint as well as the roadmap and the vision, and set out the priority goals, particularly on the short term, which is actually the first 100 days, and the medium term and in the long term. But I think what is important is that in the first 100 days, the Secretary of Health, together with the competent DOH officials, the IATF, and the other technical advisors, working with the private sector, that particular healthcare leader has to harness and consolidate the efforts of the previous administration in the last 2 years, and then come up with a solid plan that will actually align with the vision of the president to trigger economic recovery. And this is actually anchored on solutions to end the pandemic, open up the face-to-face classes, and of course, facilitate all the economic recovery measures so that we can bring back our lives to normalcy. So it is extremely important, Ria, that the Secretary of Health should be actually on board right now, so that he can provide directions to the IATF, the DOH, and the private sector.
Doctor, how would you say this is affecting the overall COVID-19 response? And how does it affect the morale of the people in the department with nobody at their helm for now?
Well, I think the demoralization is not actually there. I would say it's actually the anxiety with the choice of the next Secretary of Health. And as we can see, the president met with the Department of Health, the IATF, the technical advisors, as well as some of the key advisors of the Department of Health, including the PhilHealth. So he has a complete grasp of the situation, and of course, I think I'm extremely delighted with the grasp of the president on the healthcare issues, particularly in setting up directions, in coming up with a plan of a full definition of the vaccination, including the first booster, that is redefining the full vaccination with 2 primary vaccines and 1 booster. The second one is the in terms of preparation to the face-to-face classes, and of course, lastly, of course, to pave the way with the measures related to economic recovery. And I think the president is stepping up to the plate, but he's thoroughly and carefully reviewing the candidates that will actually address some political as well as other challenges by the health department. Of course, it's not easy coming up from the Deng Baksha issue. Um, in the past administration, and then you have the family issues and the PhilHealth issues. So it's not just like technical competence. You need here a leader with political savvy, managerial skills, and a leader with sense of urgency to tackle the issues right
That's
now.
right. Speaking
Take
of
note,
the
this is
candidates, Doctor,
pandemic plus the usual business as usual healthcare
yeah,
issues.
what do you think, or what kind of health chief should President Marcos appoint? As you were saying, they will need a whole range of skills. But, is it somebody who is a medical expert with real on-the-ground clinical experience? Or should it be, somebody who has greater expertise in management and finances?
Actually, it's a different kind of leader right now, considering the challenges we have with the COVID. It's not as business as usual. Perhaps somebody with a sense of urgency and agility, since we are addressing a crisis. Someone with the highest level of integrity, since we will be dealing here with issues with family, the Deng Baksha before, and of course the PhilHealth issues. Someone with competence that would understand the science and of course the research-based evidences. Someone with a vision, short-term, medium-term, and long-term goals, and someone with the moral courage to decide amidst the pressure given by other stakeholders. And of course, someone that has the humility to accept also the limitations of the job, given the enormous challenges by the healthcare department.
Sa tingin niyo, Doctor, what are the biggest challenges that will confront the new health secretary? As you said, this is not business as usual. It's not ordinary times. There's also political issues within the department. For you, what should the new health chief prioritize?
The new Secretary of Health should focus right now on the vaccination. I think most of the problems that we are confronted with is the recurrent surges, though it's mild right now. And of course, the economic sector would be happy with the decisions of the health advocates and other proponents of a living with the virus or dancing with the virus. I think it is important right now that we have to complete the vaccination. Right now, we have only 70 million and only 15 million for the first booster. So the challenge is really to ramp up with the booster in the next 100 days to prepare for the September, October, and November face-to-face classes. And that would be, of course, important so that you'll be able to face uh, the next 100 days to 200 days with the timeline of being reevaluated every quarter until you finish that at Christmas time. I project that I think we can need to jumpstart in the first 100 days and then reevaluate the second 100 days, and perhaps by Christmas, I think we will have an endemic state already. I think that's my projection, given the timelines also with the depth and the face-to-face classes.
All right, Doctor, do stay there with us. Our conversation with Dr. Leachon continues after the break. When we return, how can authorities ensure a safe transition to face-to-face classes? This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Ria Tanwat Cotrillo. Our source today, health advocate Dr. Tony Leachon. Doctor, welcome back to the program. Let me ask you, Doctor, do you feel that the IATF is still relevant? Is this something that President Marcos should abolish and start his own pandemic response team with a new composition of experts?
I think the IATF has done its part, but I think with the learnings that we have, in fairness to the IATF, they have lowered down the incidence of COVID cases. But perhaps moving forward, if my humble suggestion is to incorporate their health advocates, epidemiologists, those with knowledge on vaccination, logistics, and distribution, and perhaps include also the private sector, composed of those who have been important in trying to explain to the public, so that you can have on one table of brotherhood a composition of public and private stakeholders that will be able to communicate to a lot of people. I think that would be a better setup rather than you have uh, a purely government composition. I think we need to do public-private partnership at this point in time. And that would be acceptable, of course, to the Filipino people, knowing that their voices are also being heard in this particular pandemic.
Now, Doctor, as you know, COVID-19 cases are still up here in the Philippines. Metro Manila's positivity rate was up from 8.3 to, I believe, 9.8%. Octa says Batangas, Cavite, Laguna, Rizal, Iloilo, Antique, and Pampanga had positivity rates higher than 10%. Is this concerning? We know that these variants seem rather mild for most people, but is this increase a cause for concern?
Well, it's a cause of concern, but we should not define right now um, the metrics purely on the caseload of infection. We know that the viral transmission is increasing by virtue of the increase in the positivity rate, the growth rate, and of course the reproduction number. But if we will have the proper healthcare capacities in place, the testings, particularly the testing, the isolation and the quarantine, of course, guidelines, together with the preparation in the workplace at the schools with proper ventilation and filtration, and we manages also travel risks, and then work on a system that you can actually empower every Filipino to become educated and engaged in adjusting to the new normal. I think it will be okay. But while we're doing this, we need, of course, to address certain things. And one of the most important thing for the increase in the positivity rate is, of course, the increase in the mobility because we're opening up the business, the arrival of the variants. And the only way to address this without the lockdown is basically to adhere to the minimum public health standards and ramp up on our vaccination and booster program. And I think that will be those measures that will address this increase in the viral transmission metrics.
Right now, I think you spoke about this earlier, that President Marcos agreed to redefine the meaning of being fully vaccinated. Tell us again what fully vaccinated would mean under this new definition, and do you view this as a good move?
Well, originally, the definition of full vaccination was two primary vaccines when it was started in the US December of 2020. But based on the studies in Israel and, of course, the US, they found out that there's waning immunity in 3 to 6 months after the dose. So through the FDA, they implemented that after the two primary vaccines, in order to address the onslaught of the Omicron subvariants in different part of the world, they recommended a booster that is the third dose. And I think that's the minimum requirement in order to become resilient so that we, just in case we will develop the Omicron, it will just be mild. And of course, reduce the number of patients that will actually be hospitalized, those actually with severe and critical cases. And of course, they added, of course, the second booster, the fourth dose, generally not for the entire population, but basically for healthcare workers, those senior citizens, and of course, those with immunocompromised state. And I think the president is correct in these assumptions, and therefore we should actually abide by these guidelines. But the most important thing here is to do it in the next 100 days so that we can actually prepare the students for the face-to-face classes starting September and then ending in November.
Right. Okay, Doctor, thank you so much for your time here on The Source. That was Dr. Tony Leachon. Coming up, will ABS-CBN finally get a new franchise under the Marcos administration? ACT Teachers Party List Representative Franz Castro joins us after the break. Please stay tuned.